Greetings and welcome to Berkeley Conversations COVID-19. I'm Dan Mogila from UC Berkeley's Office of Communications and Public Affairs. Recently, our Institute of Governmental Studies, the IGS, together with the California Institute of Health, Equity, and Action, conducted a poll in California to gauge opinion about the COVID pandemic and its impact. It was one of the first polls of its kind in the country. The results were striking, to say the least, and we're fortunate to have with us three faculty experts who helped conduct the poll and analyze its findings. Cristina Mora is a co-director of the IGS and an associate professor of sociology. Eric Schickler is the other co-director of the IGS and a professor of political science. And Hector Rodriguez is the director of the California Initiative for Health, Equity, and Action and a professor of health policy and management. If you're watching this through Facebook Live, feel free to post any questions you may have as we go along, and we'll do our best to answer. So what I want to do to start off is sort of go around the horn here and ask each of you, starting with Cristina, what were a couple of findings that jumped out at you from the poll, and why did they jump out, and what do they mean?
Yeah, sure. Thanks for having us on, Dan. We really appreciate this.
Sure.
I think one of the biggest trends that stuck out at me was just really the sort of racial and class differences that we found across the board. So going into the poll, we knew to some extent that COVID would exacerbate the existing racial and class inequality across the state, but we didn't know how much and in what ways that this would be the case. And so we designed a series of questions that would not only sort of gauge who fears COVID the most or who sort of feels that it's a much more of a threat to their health than their economics, but also questions about who's actually being more exposed to some extent to COVID. And you know, for me, the results were quite stark. I'll just share a couple of slides that speak to this. Let me go, here we go. So in this first slide, you'll see, in this first slide, you'll see a stark difference between, so on the one hand, Latinos, Asians, and Blacks were all much more likely to say that COVID was a serious threat to their health, much more likely than whites to say that, for example. So we knew that the belief of the threat or the perceived threat was already there. But we also found that racial minorities were also more in situations that they were more likely to be exposed to COVID. So on this first slide, you'll see there's a 20-point difference between whites and Latinos, for example, on who is able to work from home safely. On our other slide, you'll see, for example, who is more likely to report that they not only have to leave their home to go to work, but also work in proximity to others. So you can imagine the grocery store clerk that has regular contact with customers, the people keeping Home Depot, Costco, CVS pharmacies open. All of these are in situations where they're, are less likely to be able to go to work and self-isolate there or stand behind an office wall. And so not only were minorities more likely to fear the effects of COVID, they were also more at risk. And the other type of risk or the other fear that we looked at were the impacts of COVID on sort of economic risks, right? To what extent is COVID been a threat to your economic situation? And we also see here stark differences. If we just look at this first table we asked our respondents, to what extent is COVID a serious threat to your ability to pay for basic needs? Food, shelter, things of the sort. And we see a real stark racial trend here with racial minorities reporting that the effects of COVID directly is really threatening their ability to afford their basic needs. So when I think of this on the whole, not only are minorities more threatened and scared of COVID, they're also much more exposed, and it has serious, dire consequences, even in California for them.
So let me come back to it. Something you said that the poll revealed or showed that, there's even greater level of inequality. I'm a layperson, and I always thought polls are about opinion and perspective and perceptions. But you seem to suggest that. So let me just ask you, are these polls about how people feel, or can we actually derive should we have confidence that their feelings are actually a reflection of reality?
So it's both, right? I mean, our data is only as good as folks will give us, truth. Folks will answer it truthfully. We can't, we can't. We have to rely on their being able to give us truthful answers. So on the one hand, there is the perception. So if I might feel that COVID is not a serious threat to me, and someone that looks exactly like me, the same social status situation, might feel just that it is a threat to them, right? And so that might just be differences of opinion and perception. That's why we asked who's actually leaving the home for work, right? Because we know that leaving and being in situations where you're around others, grocery store clerk. In fact, we created an occupational category just for this poll that hadn't been used before. And it was the category, we named it essential retail. So who are in those retail positions that are not, for example, clothing store or hat stores, but the grocery stores, the hardware stores that were still open, the pharmacy stores, right? Deemed essential non-medical workers. And 100% of the people that checked that they were in this essential retail categories were either Black or Latino.
Wow.
So it was this measure of actually who's out there being exposed still during this moment of shelter in place.
So we're going to come back. I've got a number of other questions about this because it's super interesting. But for right now, before I move on to Eric, was there anything about those findings you just discussed? Was there anything that surprised you?
I just didn't think of the severe. I mean, we also asked, having been a scholar of racial inequality in the United States, I would think that there would be these stark differences. I didn't think that they would be this big. I didn't think that 100% of the people saying that they were in essential retail would be this large. And I think also we were able to devise some questions about whether you fear for your family members, right? If you think of racial minorities, Asians, Latinos, Blacks are much more likely to live in multi-family situations, right? Multi-generations, have grandparents, grandkids. And if you think of the fact that already there's economic inequality, and so these folks are also in these essential retail and then coming home in these sort of multi-family situations, I think that the data gives us a good sense of who's more at risk and who's being exposed. I think the worry about their families and the situations, we had thought that maybe because they were much more likely to be economically impacted, that they were also more likely to want to get the economy started again, to be against shelter in place. And we found actually the reverse was true in a real surprising way, that minorities were actually just as likely or slightly more likely to want to keep shelter in place going, even though, COVID had much more reportedly directly impacted their finances. And so even though we found minorities were burdening much of the economic risk of COVID, they weren't necessarily quick to want to get the economy restarted and open up again, in part because they also shoulder so much of the health risk too.
Yeah, really interesting. We're going to come back to this, but Eric, let me turn to you with the same question. Which findings jumped out and why?
The most striking findings had to do with partisan polarization. So, it's become pretty well established that Democrats and Republicans in the United States are deeply divided, but you might have expected that a global pandemic might bring people together and erode partisan differences. And what we found is, at least in some important ways, some pretty big differences between especially those who approve of President Trump and those who disapprove in how they think about the response to COVID. So I'm just going to put up a slide that summarizes a little bit of that, gives us flavor for those results. So one question we asked is whether you're more worried that shelter in place will end too soon, thus exposing people to health risks, or are you more worried about it lasting too long and leading to greater economic damage? And the blue bars are those who disapprove strongly of President Trump. And you see about 90% of them are more concerned about shelter in place ending too soon, and fewer than 10% worry that it will go too long. Whereas we see basically the reverse among Trump approvers. They are much more worried about the economic damage and much more eager to get the economy going again. So that's one on a big policy issue that you see a big difference. We also see some differences that maybe play more to your personal beliefs or behavior with respect to COVID. So we saw differences in views about the effectiveness of social distancing. And we have this, the column here, we ask, how concerned are you about spreading COVID to others? And those who disapprove of Trump are much more concerned than those who approve of Trump. And then finally, having to do with the scientific evidence, who do you turn to for information? To trust scientific experts when it comes to information about COVID. So we see across this kind of range of attitudes and behaviors, some indications of important partisan differences. And now we're seeing that playing out even more so with some of the debate over use of masks, where the president has sent much more of a mixed or ambivalent message about that. And we're seeing a fair number of Trump supporters who are showing greater reluctance to wear masks, even in public places like grocery stores.
Anything surprise you?
Well, I mean, I think to a certain extent, we've come to expect this partisan polarization. Yet I think where it surprised me a little bit has to do with the individual behavior. That when we ask people about, how effective is social distancing? How effective is wearing a mask? Those are the kinds of things where you might expect to see more of a consensus. And we saw some real differences between the parties there. And I think that was at least somewhat surprising.
We're going to talk more after we give Hector a chance to weigh in about this whole issue of polarization and why one's political beliefs would impact your attitudes about public health measures. But Hector, let me turn to you. The findings that jumped out and why they jumped out at you.
Sure. I'll just pick up where Eric left off. And the one area that surprised me, I won't show data about, is support for farm worker protections among voters in the state. I expected to see a political divide here, and what we see is overwhelming support for protections for farm workers, for paid sick leave, for enabling social distancing, for employers providing hand washing stations and other protective equipment for them. So I think even though we do see Trump, those who approve of Trump having less support of these things, on the whole, the vast majority, even among those who are Trump supporters, do support these protections. And that's a real place where we can coalesce in the state around and move forward supportive policies. Another thing that's been clear as part of this COVID-19 pandemic is people's fears of employment insecurity and job instability. And the traditional way that we get our health insurance coverage is employer-based. And this is an outlier. Other countries do not have employer-based insurance for the most part. They have national insurance programs. And as unemployment happens, individuals are really scared about losing their health insurance. And so we were interested in comparing, now that these economic insecurities have reared their heads, compared to the past, how do Californian voters feel about a single payer option or Medicare for all kinds of programs? And what I'll do is I'll share some of those findings with you that haven't been out on press. So these are fresh, kind of hot off the press. And what we see here is you'll see in the blue bar, dark blue bar on the left-hand side, those are those who strongly agree with the statement that a single-payer health care system such as Medicare for all, in which Americans would get their insurance from a single government plan, would improve the nation's ability to respond to disasters and pandemics such as COVID-19. And we see here over 55% of California voters agreeing or somewhat agreeing with the statement. Those who disapprove of Trump have 74% agreement with this statement, and only 16% of Trump supporters do believe that a single payer system would help respond to these emergencies. But on the whole, we see, compared to the past, where California voters were at 41% supportive of a single payer, we now see this tipping over 50%. Now, the questions are a little different. This is about ability to respond to disasters and would a single payer option work. So it's not deliberately asking individuals to give up their private insurance, although that's implied by the question. And we do see here greater support for the idea of single payer here. And what was really striking to me with related to these is the data when we disaggregate them by race and ethnicity. Asians, Blacks, and Latinos have over 60% support agreement for single payer, whereas whites are about 50%, irrespective of political party. And where we see the divergence is actually among Native Americans and others who have less than 50% support agreement. But the major ethnic and racial groups in the state have changing attitudes, more open to the idea of single payer, because we think this pandemic has uncovered a lot of the insecurities associated with job-based healthcare, employment-based healthcare.
So I wonder, for those, a lot of people talk about their hopes and wishes that there is some good that comes out of these extraordinary times. Should people like this, for those who support the idea of single payer, for those who support the idea of greater support and benefits and services for farm workers, should they be heartened by this and believe that that these numbers could represent a sustainable or lasting shift in attitudes? Hector?
I think for the farm workers, the COVID has clearly highlighted the dependency on farm workers. We all have experienced shortages of getting the things we need at the grocery stores, and that is making a connection, I think, to the public. And so I think this farm worker support is ripe for policy change, and sort of the train has left. And I think what we'll hopefully see is more public support for protections for them. The single payer is a hairy issue, and we know that that it's a long pathway to getting that, and that there are many intermediate solutions that could take us in a direction to have universal coverage. I think the data bode well for universal coverage. The mechanism by which everybody's covered is a little hairier, and I don't think we can draw inferences about that from this question. But I think the temperature indicates that the public is willing to move and change the healthcare system in a dramatic way to ensure that we're more protected and can better respond to these. I think the public has seen ventilator shortages, we've seen PPE shortages. We know we have an uncoordinated healthcare system. And I think what the data reflect is an appetite for broad change in the healthcare system to prevent these deficiencies from happening again.
So let me ask, I want to pose a question to all three of you. As a layperson, I consume polls around presidential elections because I want to know who's ahead, who's behind. It's sort of like a spectator sport. It's almost like reading the standings for baseball. But can polls like these affect change? What, besides sort of a curiosity, how do you look at polls? What's their utility? What good are they other than getting an idea of how our neighbors think? Cristina, let me come to you with that one.
Well, I think getting a sense of what our neighbors think is really important, and policymakers, so lay people pay attention to it, but policymakers really pay attention to it, and elected officials, when they're trying to figure out, a lot of this is trying to figure out, of all the things that we can pay attention to, of all the needs, things that need money, things that need our attention, where is it that I should go? Right? We don't have endless limited resources to address it. At least elected officials might think that. And so polls are a good way to gauge the temperature. Does something like providing medical benefits for farm workers during this time, right? Is this the moment? And so the poll provides that. It strikes me, we didn't ask a question about meat packers, right? And we didn't ask this question about essential retail, but had we done that, right? Maybe there is a chance or an opportunity here for thinking about new policies developing. And also, if you've got such a high 80% of Californians supporting the sort of medical benefits for farm workers, that's a large amount that goes beyond the Republican Democratic sort of spread, as Hector was saying. Right. And so maybe it also gives us a chance to see where the nation can converge, right? And go beyond polarization.
Yeah. Eric or Hector, anything either of you'd like to add to that?
I mean, I guess I would add that it also gives us a chance to see when is the news perhaps unrepresentative of what's going on. So, for example, we had the big protests against shelter in place. Or big protests, and certainly the public actually supports keeping shelter in place. And that puts in perspective those very loud voices of folks showing up to the state houses in Michigan.
So literally, it seems like you've frozen there for a second. So I'm just going to pick up that the poll reveals literally a silent majority or a quieter majority. Hector, anything you want to throw in on that particular question about the utility of
Yeah,
polls and their importance?
I guess in the revised governor's budget, there were a lot of supportive programs that had to be cut out of necessity, given the tax base shrinking and all of that. But these polls lend insight into prioritization as these cuts are made and sort of what the public really cares about in that window of opportunity. Clearly, with the budget situation, not everything that has public support can become policy, but at least it provides some insight into the prioritization of those issues.
So I want to go, we've got a couple of questions that have come in off Facebook Live that revolve around the same thing. And it's people asking whether you saw any differentiation in the responses based on the respondents' geography within California, rural, urban, exurban, et cetera. Can one of you address that? Talk about how that shook out? Hector, please, go ahead.
I can definitely talk about that because it relates to the farm worker finding. So the one geographic variation that we saw there was the Central Valley and Inland Empires having substantially less agreement, actually opposition to the ideas of individuals, farm workers getting protections, having family paid sick leave and health benefits and the like. So it was quite sobering to see that their neighbors, where they have more interaction with these workers, is where they have the most opposition. So we saw 1 in 4, 25% of Central Valley voters, irrespective of party, actually disagree with protections for farm workers. So we clearly see that jarring difference. In contrast, in the Bay Area and LA, opposition is less than 10%.
Interesting.
For these protections.
Cristina or Eric, did either of you see a geographical differentiation in terms of the areas you were focused on?
So I think the bigger one is in the far north and some of our redder counties inland, we're much more likely to want to end shelter in place and start reopening the economy. And that wasn't surprising. It maps onto basically, how California in some ways is an exception, but in many other ways, it's also a deep reflection of the nation. We have our red counties, we have places with strong Trump approval, and we saw that in the data too.
So one of the things that I want to ask all of you about this that really jumps out, and it's every poll we see these days, and that's the polarization that you all talked about in one form or another. And I think there were many of us who thought, like, how could sort of basic epidemiological concepts become fodder for political argument? But they have been. Exactly that has happened. What do you think this portends for the country? What does it say about the election? And COVID's shining a pretty bright light on this stuff, on these divisions, and how we deal with what used to be considered neutral facts. You guys are all experts, sociologists, political scientists. Eric, let me start with you. Look into that crystal ball, and what's this telling you?
Yeah, well, I mean, I think that this was really an opportunity in some ways for us to see the government respond in a way that goes against type, that's not the typical polarization. We've seen a handful of Republican governors really respond to this in a way that was much more proactive and similar to a lot of the Democratic governors, so something like Mike DeWine in Ohio. But President Trump has returned to the playbook that he's gone to time and time again, which is premised on rallying his base. And I think in the short term, that may well be effective in terms of, winning the news cycle for his core supporters and rallying them against some of these public health provisions. But I think, thinking a little bit ahead, in the long run, if this leads to more cases, for example, in the fall, that in turn is going to hurt the economic recovery that he's going to depend on for his reelection. And so it's not this kind of short-term. What we're seeing is the damage caused by this short-term approach, this lack of a focus on governmental effectiveness, a focus on public health. And, I think we're seeing some of the really bad consequences of that. And at least there's the potential for it to backfire on the president, in which case maybe that would teach a lesson to both, really across the political spectrum, that at least sometimes you have to take science and public health more seriously than the short-term political battles.
Hector, what do you think? What does this all portend, this polarization around
Yeah,
something
I think
that...
one clarifying point I just wanted to put out there is the polls are lopsided. We have a 2-to-1 balance on the poll. So those who approve of Trump are 1, and those who disapprove are 2 for every 1 in California voters. So just to be clear that these polls aren't pulling in equal force. Second, I think nationally, the polarization makes us very vulnerable to outside influence like we've seen in the last election. It's easy to play on our divisions, and outside influence is taking advantage of these, the fact that we're so polarized. So I do worry about the level of polarization and its impact on outside influence. But I think in the state, with respect to policy change and getting things done, we have to realize that the poll is lopsided and that it's a 2-to-1 polarization.
So before we go to Cristina, I want to ask you, and this is coming up on Facebook right now, are you saying that we have to keep in mind that California demographically and politically is quite exceptional within the context of the United States? Hector?
California is the future of the United States. So it's sort of a canary in the coal mine as to what Kansas is going to go through, what North Carolina is going to go through in a decade or two.
You mean do you mean demographically?
Demographically and politically, that comes with that. And so I think these may seem maybe outlier for us in California, but the demographics are shifting in a way where the rest of the country is going to look at us and like us, and politically is going to be composed just like California, potentially.
Great. So Cristina, I want to come to you with the same question, your take on the meaning of polarization, what it pretends. But also before you go there, just an interesting question again from Facebook here. What were the demographics of the people who polled? I'm assuming they were, as much as to the extent possible, a reflection of the actual demographics of the states. But, I think people have concern that maybe the poll didn't look at everybody or just looked at a slice of the California population. So a 2-part question for you.
Yeah, so I'll answer the second one first. We ran the poll April 16th through the 20th, so it's dependent on who answered our email at the time, which doesn't mean that you are going to get an accurate reflection of California. But all the analysis that we have here are based on what we call weighted data, which are weights that we place so that our data can actually then reflect the registered voter population. So we are missing a key demographic that could shift some of the findings, and that key demographics are sort of all those that are not likely voters, all those that are unregistered. So we don't have the undocumented answering these polls. We don't have legal permanent residents. The only people that answered the poll were registered voters. So that gives us some sense, but it also skews, the amount to which we were saying who's at risk, for example.
Okay, now part 1.
The harder question. So Eric and Hector are good at sort of telling us how difficult political polarization is going to make the elections. And I'll give a pitch for the opportunity that we have here too. So on the one hand, yes, we're much more vulnerable, and this is definitely, Trump is playing to his playbook. But I think as sort of the pandemic wears on and people really see the economic hit across the board, professionals are going to see an economic hit, across racial groups, there'll be an economic hit. Then this becomes an opportunity to really think about a new normal, right? And this is where I think the civil society, nonprofits, activist groups, unions can come together and be amongst those to really create and chart out that this is not business as usual. We cannot have the same policies. We cannot go back to the same type of scapegoating. We need a new blueprint. And I think this is where, a lot of the civic sector can come into play, and it'll depend a lot on their ability to get the message out that political polarization goes hand in hand with the immense amount of economic inequality that we are already seeing now, and that's going to be exacerbated as the fallout of the pandemic continues.
All right, so we have time for one question for each of you, and I want to ask each of you, and it's a personal one. So you're all faculty at UC Berkeley. You don't just do polls, there are things you study and you write about. Last 10 weeks have been extraordinary. And let me start with you, Eric. What are you interested in studying right now? What sort of raw material are you seeing? And what are you sort of dying to know more about? Eric.
Well, I mean, I think that the big concern that many of us have had is the sort of future of American democracy. Can it function amid this, deeply polarized situation in which one party is really now putting, challenging some. This is going to be an immense stress test for our electoral system and democracy more generally. So seeing, are we able to hold a fair, free election in which everybody has the opportunity to vote? That's going to be a huge challenge.
Yeah.
Hector, same question. What's really got your interest here in general, and what do you want to be studying and learning in the months ahead?
I was fortunate enough to get new funding for a COVID project focused on telehealth implementation in federally qualified health centers, the clinics that care for the poor and underserved in the state. And this is a game changer for them in the positive direction in some ways. There'd been a lot of limitations prior to COVID on using telehealth. And we know low-income individuals have opportunity costs when they go to get care. They have to get out of employment, get childcare, all these things. But reimbursement and payment had been limiting up to this point. And so one opportunity that COVID presents is changing the healthcare system, particularly for the low-income patients, and changing what gets paid for in terms of those things. So I'm really following those issues very closely.
Great, Chris. Thank you. And Cristina, you had the first word. We'll give you the last word. What's got your interest? What are you going to be studying and delving into in the months ahead?
Well, before the pandemic hit, I was really interested in California and what's going on in sort of, as economic inequality meets with, the increase in racial diversity across the state. And so in what ways that is playing out for our political future. And as COVID hit, COVID is the new normal. And so I'm interested in hearing what impact has COVID had on our ideas of sort of what the political future is here in the state. I've got, with a colleague of mine, a sample of about 60 Bay Area residents in sort of the upper working class, and we'll be following them now for about 2 years to see not only how did COVID impact them now, but how is the fallout of the pandemic impacting the working class in the state over time?
So I want to thank the three of you for a really interesting conversation. I can't wait to see the next poll. For those of you who've been watching today, you can do a simple Google search for IGS in Berkeley, see past polls they've done, dive deeper into the data behind this most recent poll. And again, we'll have future Berkeley Conversations events. Check out the webpage. And in the meantime, be well, stay safe, and by all means, keep your distance. Thanks for joining us today.
Thank you.